Okay, let's dive into an explainer of a surgical innovation that quite literally transformed the world's most common procedure. We're talking about the caesarean delivery today, and specifically, we're going to look at a really fascinating technique known as the Stark method, or sometimes it's called the Misgav Ladach method. For something so routine, the history and the evolution of how this surgery is actually performed is incredibly compelling.
To really wrap our heads around why this innovation matters so much, we first have to look at the numbers. The global rate of caesarean deliveries has jumped massively, from around 7% back in 1990 to a staggering 21% in 2023. I mean, this is the most commonly performed surgical procedure on the planet. But here's the massive problem. Despite happening all the time, there is still no truly standardized surgical approach globally.
Here is our agenda for this explainer. 1. The global caesarean problem. 2. A minimalist surgical philosophy. 3. Smarter incisions and access. 4. Delivering the fetus safely. 5. Efficient suturing and recovery. And 6. A new global standard.
All right, Section 1. The global caesarean problem.
So the absolute crucial point here is that despite this surgery being performed millions of times every single year, doctors everywhere still do it completely differently. It's kind of wild. Substantial variations persist across different countries, different hospitals, and even just between individual practitioners. We're seeing huge differences in the choice of abdominal and uterine incisions, how the peritoneum is handled, and the methods they use for uterine and abdominal closure. It's just a highly variable landscape for such a common procedure.
Moving on to Section 2, a minimalist surgical philosophy. The story actually takes us to Jerusalem in the 1980s, specifically to the Misgav Ladach hospital. This is where a major reevaluation of the caesarean delivery kicked off, and it was entirely rooted in minimally invasive principles. Think of it as a minimalist revolution based on one very simple premise. Critically assess every single surgical step for its necessity. If a step was deemed absolutely essential, they optimized it for peak efficiency. And if it wasn't, well, they just entirely eliminated it. It's all about asking, what happens if we only do what is absolutely necessary?
And every single decision made in the Stark method is anchored deeply in that classic Hippocratic principle. First, do no harm. By eliminating unnecessary cutting and suturing, the surgeon is actively minimizing the trauma inflicted on the patient's body.
Section 3. Smarter incisions and access.
Traditionally, standard incisions like the fawn and steel actually make blunt dissection kind of difficult, mostly because they require dissecting the rectus fascia completely off the muscle. But by placing the incision just a few centimeters higher up, the fascial nick is made superior to the pyramidal muscle. This incredibly smart, slight adjustment perfectly preserves the tissue planes. It completely avoids unnecessary dissection, and it greatly improves access right into the lower abdomen. And this is the whole less is more motif in action. Instead of relying heavily on scalpels or sharp scissors to literally cut through the muscle tissue, the surgeons actually use their fingers to stretch the rectus muscles laterally. They're separating the muscles easily and naturally along their existing planes. It's a pretty remarkable concept, minimizing trauma through technique rather than sharp tools. Which brings us to Section 4, delivering the fetus safely.
The contrast here is fascinating and really highlights the Stark method's ingenuity. Traditionally, accessing the uterus involves sharp scissors or a scalpel to extend the incision. The Stark method radically alters this. After a small transverse incision is made in the lower uterine segment, the surgeon's index fingers are used to gently penetrate the uterine wall. The incision is then extended laterally by 2 fingers, one on each side, just stretching the opening transversely. Again, the human hand entirely replaces the sharp instrument, which ensures a much safer, gentler entry.
Okay, Section 5, efficient suturing and recovery.
Now get ready for a completely counterintuitive medical fact. For a long time, traditional methods involved meticulously suturing both the visceral and parietal peritoneum, the membrane lining the abdominal cavity. Well, the Stark method leaves the peritoneum completely open. Why? Because the evidence actually shows that towels and traditional suturing are what cause adhesions, that internal scar tissue. Leaving the peritoneum open surprisingly prevents those adhesions from forming in the first place.
When it comes to suturing the exterior, the Stark method optimizes everything here too. By using a single-layer locked continuous suture with a remarkably large needle, the surgeon can reach the fascia with just the tip of the needle. This is highly efficient because it entirely eliminates the need for tying subcutaneous knots even in patients with a higher body mass index. Plus, suturing from the surgeon's side toward the assistant is ergonomically preferred, which saves crucial time on the operating table.
And because the surgery itself is so much less traumatic, the post-operative recovery is surprisingly fast. Let's walk through this sequence because it's pretty great. Step 1 is early ambulation, getting the patient up and walking, which significantly reduces thrombosis risk. This is possible because the fascia wasn't dissected from the muscles, so everything glides freely. Step 2, oral fluids are initiated shortly after surgery. And step 3, which is highly relatable and honestly quite surprising, chewing gum. It's actually recommended because it significantly expedites the return of normal bowel function. Who knew?
Finally, Section 6, a new global standard. When you objectively measure the Stark method against traditional, unstandardized approaches, the evidence-based benefits are just massive. We are looking at consistently faster skin-to-delivery times. Patients experience significantly lower blood loss during the procedure. Post-surgery, there are far fewer painful adhesions, which naturally leads to the final point, a significantly reduced need for post-operative analgesics, or painkillers. It is simply a vastly superior experience for the patient. And this evidence builds a really compelling global picture. The beauty of this method is that its simplicity and safety have successfully crossed borders everywhere. The Stark method's efficacy has been proven and adopted in highly resourced nations like Sweden and Germany, as well as developing nations like South Africa, China, and Senegal. It is universally applicable because it relies on solid anatomic logic rather than expensive, specialized technology.
Which brings us to our final thought for today. We started out by noting that despite being the world's most common surgery, the caesarean basically lacks a global standard. Given the undeniable evidence, we're talking reduced harm, much faster recovery, and proven international success, we have to ask, is it time for all international obstetrical societies and residency programs to finally mandate the Stark method as the universal clinical standard? It definitely leaves you wondering why it isn't already. Thanks so much for joining me on this explainer. I hope exploring this incredibly structured approach to modern medicine sparked your curiosity.